Look, we're a generous country, and so we should be. We should be proud, not ashamed of that. We take many people in who need our help, refugees. Some of them actually not founded refugees. We're not sure if they're genuine or not. However, we'll give them a chance. Healthcare paid for. There are reforms taking place, changes taking place, actually for everybody, but including refugees. And some people say it's very unfair. One of them, Dr. Alison Eyre, who joins us from Ottawa. It seems to me, I mean, and again, I'm not a doctor, I could play one on TV, but if people come to the country as unfounded refugees, we look after them, but they were getting rather special treatment, healthcare, dental care, that other Canadian citizens don't receive. Do they deserve that?
Well, that's an excellent question, Michael. The way I look at it, most of the refugees who we see in our clinic are not unfounded. I can't really deal with the issue of unfounded because to me that's an issue of a legal issue and of citizenship and immigration. The refugees we see, predominantly, even those who come as asylum seekers, they come through a process and they are being viewed by Health and Citizenship Canada and through the legal channels. Basically, our responsibility as healthcare workers is to assume that many of them are actually going to become citizens in Canada, and if we want that, we want them to be given the best chance possible to be able to be gainfully employed as soon as possible.
But these reforms don't affect every refugee, do they?
No, actually they do quite significantly affect all refugees, including the refugees who come through the UN Convention. The thing they have the greatest effect on the refugees who come in through the UN Convention route, who are called the government-assisted refugees, is that they lose access to benefits which help them with prescription medications as well as non-urgent medical treatment.
Such as?
Well, such as, so if you have, I mean, I think of a gentleman I have who came in recently. He's a young man in his 40s, but he happens to have diabetes. So he has the job now of, you know, he has to change his employment situation so that he works all weekend. He takes English classes during the week, but he has to pay for his, starting on July 1st, he's going to have to pay for his medications. Right. So as a diabetic, what is he going to choose? He has to, you know, he's been extremely good at changing his entire diet to the Canadian diet, but he's going to have to choose between medications and diet.
Well, he sounds like Refugee of the Year because I agree there are people like this. And by the way, now I'm not here to decide and arbitrate between you and the government. The government say you're completely wrong. It doesn't affect every refugee. But I also know Central Europe fairly well. Yes. And you surely know this, that Canada is thought to be assumed to be a soft touch. There are all sorts of people who come to this country, claim to be refugees. They may only stay a year or two. If they're lucky, they'll just fade into the general population. And they assume they will have their dentistry, their medical care taken care of. Go to Canada. It's where you'll get free health care. You know that occurs not just once or twice, but hundreds of times.
Michael, unfortunately, I don't have the benefit of knowing a lot about Europe, unfortunately. But the areas that I deal with mostly, predominantly in Ottawa, get refugees from Africa, Asia, the Middle East. Most of the people.
Where in the Middle East?
Well, not necessarily right now, but we have been getting quite a few from Iraq. So those refugees are ones who either come in as government-sponsored or they come in and claim asylum. Basically, the ones that we get, particularly when you get them in the middle of January, they have not picked Canada. They actually have just gotten wherever they could get to get out and be safe. So I can only speak to my experience, which is that the majority of people that we see, and we do see a lot of the people who come through into Ottawa, I just don't have that experience. Right. And I can promise you, as a taxpayer, I would be equally as concerned as you are.
Well,
and if that were my experience.
So, because you can understand how people will be upset. Dentistry, for example. You know, we have 4 kids and you pay for the dentist. We have no private insurance. It costs a lot of money. I have a relative waiting for medical treatment on a hip replacement. He's been waiting for so very long. When you hear stories of people who are jumping ahead, and when the government says these are terrible economic times, we have to cut back a little, and maybe immigrants, no, sorry, wrong use of the word, refugees, maybe even bogus refugees, will be treated in the same way as ordinary Canadians. That doesn't sound draconian to me.
No, and I totally agree with that. But in my experience, the refugees who come in through either route, the only dentistry they have access to is basically emergency dental. So they can get their teeth pulled. They do not get their teeth cleaned. They do not get braces. Now, I would imagine for you, that's what you're hoping for your 4 children.
No, I'm English, for goodness sake. The fact that I've got my teeth is a miracle. But hold on. Cleaning and braces, forget that. They do get fillings. They do get their teeth taken care of.
They
get expensive
very
treatment.
basic. You know what? I have to say, I'm not a dentist, so I'm not the one who deals with any of the dental things. Dentistry hasn't been a big issue for a lot of my clients. But the only people who I've referred to get dental work who've gotten things done, the only access I'm aware of is very emergency. If they're having a huge abscess, the tooth needs to go, it goes. So once again, I can only speak to my experience, and I do refer people, and I definitely do a lot of mouth exams. Some people come with incredible poor dental issues. Right. I have never seen them get what I consider to be excessive services.
I think that what you're doing, it comes out of a good heart, and you mean the best, and you probably have achieved greater things than I ever will. But I fear among some of the people protesting this, there's a certain naivety, but we must agree to disagree, and I'm off to the dentist. Thank you so much. I appreciate it.
Well, have a good time at the dentist. I hope it's paid for. Thank you.